Welcome to the Health Daily Show. I'm your host, Chitra Nabat. Joining us today is Othman Laraki, CEO of Color. Othman, welcome and thank you for joining us.
Thank you for having me. It's great to be back here.
Othman, tell us all about Color. What's unique and different about your company?
Sure. So Color is a last mile healthcare delivery company. So today what we do is we work effectively in taking basic and essential primary care and delivering it into communities where people's lives actually happen. So today we serve about 13,000 sites across the country. So to put in perspective, that's more locations than there are Walgreens. And we work with government programs, with private employers and payers, so over 2,000 institutions, to serve millions of people to do basic healthcare services, but taking them to schools, workplaces, churches, nursing homes, and so on, places where life actually happens. And we cover three core healthcare areas. One is what we call essential care, which is effectively an unbundling of primary care services around cardiometabolic health, so cholesterol, diabetes, hypertension, cancer screening, and so on. Second category is around infectious disease. So we do a lot of work, especially on the government side, for things like obviously COVID, but other HIV and other STI, hepatitis, and so on. And then finally, behavioral health, which we actually just announced a couple of weeks ago, where we are starting to deliver services that, again, all the same principle is to make healthcare services very simple to access, deliver them at the last mile in a hybrid model where it's both on-site as well as digitally to people. So people don't have to be jumping through a million hoops and spending a lot of money or uncertainty in terms of getting basic healthcare services that we all expect today.
There are so many startups, founders at this conference and out there across the United States, and a lot of them use similar terminology to what you just did. So for that healthcare buyer, for that provider or that school system or whoever the case may be, bring it to life for us a little bit more in terms of exactly where you guys begin and end.
Totally, because I think the reason there are so many people kind of going after this is that it is a huge problem and a huge need. And the question is, we have huge amount of spend and money in healthcare, but unfortunately we're unable to serve people in a way that actually works, especially for underserved communities like in Medicare and so on. And one of the big things that Color does that's very unique is that we didn't say, okay, we're a telemedicine company or we're a at-home care company. We apply this hybrid model. We built this entire logistical infrastructure that enables us to work with local providers. So Color actually does not employ an army of provider or build like huge diagnostics labs and so on. What we do is we have technology to integrate local capacity, of which there's actually quite a bit, but enable that local providers to be able to work directly with communities and take away a lot of the friction of access, which is what oftentimes stands as a big barrier in order to be able to serve people efficiently. And so really it's about bridging that last mile with simplicity, integrating the services so that people they can show up and they can get literally like all of their core healthcare services taken care of in the parking lot of a church or at their workplace and so on. And so just simplifying that model in a pretty drastic way.
So it sounds like you're a category creator, category changer. What category is that? And walk us through some more of the differentiating dimensions of your business and operating model.
Sure. I think, I'm guessing that when we look a few years from now and we look back, I think literally everything we're doing is going to be called just primary care and kind of just like basic essential healthcare services. Like I think this is the future of how primary care should be happening. It should not be designed around you needing to go and hunt for a primary care provider, spend your time and effort to try to go find them and just see them once a year. It is a model of primary care that takes healthcare and puts it and integrates it into people's lives. So I think actually in some ways it's a new category in the sense it's just the new version of primary care, the way it should actually exist in today's world with both the assets that we have in technology and so on, as well as the constraints under which we're operating. So in my mind, it's basically effectively primary care.
How do you get mass market adoption?
So right now we're working with over 2,000 institutions. We've served about 5 million people in the last year. And so I think we're already at that point where we're starting to see, pretty substantial numbers. Obviously, it's still a tiny, tiny slice of the United States, and also we're serving a relatively small portion of their, healthcare lives today, which I hope we can expand dramatically. But I think like the growth here is really driven by, I think all of the real payers, which is like government programs, employers who are funding half of U.S. healthcare. Everyone's trying to achieve the same thing, which is one is to lower cost, and two is to maximize access for the services that you really want people to use. We want people to do more mammographies, more colonoscopies, manage their cholesterol, get vaccinated, and so on. And so everyone has that same goal. And so I think really this is more about just kind of adopting a new model that actually makes that goal accessible, as opposed to trying to apply the same solution that clearly is not working today.
Let's get into value-based care. Talk about the continuum of your business model, going from fee-for-service, fee-for-value to value-based care, and how will you get there?
Yeah, absolutely. I mean, I think one of the big evolutions that I think is actually going to be happening in the next few years too is even the term of what we mean when we say value-based care. I think really what we mean increasingly, it's a health system and a care delivery model that actually delivers cost-effective services in a way that's convenient and accessible to people so that they actually use them. Right? So to me, that's what value-based care is. And so I think over time, that separation of saying fee-for-service versus value-based care is actually a distinction that's going to kind of go away. I think the reason we think of those being separate is because we don't have a competitive marketplace. So I think as services get competitive, like, if you think about, your life as a consumer, you think Amazon delivers good value to you. You have a completely fee-for-service relationship with Amazon, right? Like if you want something, you just pay for it. You don't get like a capitation or anything like that, except for like, the video part, etc. But what's interesting there is like it's the competitive market that creates value in a marketplace like Amazon. And I think that is really what needs to happen in healthcare. And I have I'm an eternal optimist, but I think we are in that window of time when that is going to happen, which is like creating a truly competitive market, which is what creates value. How that value is paid for, whether it's a capitation or by transactions, is in some ways almost incidental to the type of service that you're actually talking about.
Othman, let's get into leadership. In business, in life, there are codes, rules, norms, and how things are done. Where have you been a code breaker in career or business, and how did you do it?
I mean, I think to your point, there are rules you want to follow and rules you don't want to follow. In healthcare, obviously, we are in a regulated market. We are dealing with very high stakes, relationships with the people we serve. So, in healthcare, you can't take certain types of risk in terms of like the quality of the service you offer. Where I think, however, there are a lot of opportunities to be a code breaker is to question the mechanism through which we actually offer a market of services. So, for example, even from the day that Color started, we thought of that separation between doctors, diagnostics, and therapeutics as being kind of incidental. Like in many cases, actually, that is a source of challenges for people where they need to jump through a lot of hoops. And so sometimes, for us, I think we're with Color where we've been, I think, quite innovative. And the way I like to think about this is to question some of those like incidental structures that happen to be one way just because that's how the market evolved, but doesn't necessarily mean it's the right way for it to go from here. And so I think that's one of the biggest sources of opportunities to just kind of question some of those default constructs that all of us just assume make a lot of sense, but maybe don't when you look into the future.
Othman, thank you so much for joining us.
Thank you for having me.